Hi, I'm Dr. Ryan. I'm a psychologist at the UAB Civitan-Sparks Clinics. I work mostly with children, adolescents, and adults with autism. So I thought I would talk a little bit about some coping strategies for adolescents and adults with autism during COVID and for their families. So this has been very unsettling for a lot of people. Routines have changed, how we function in the community has changed, the way that we normally go grocery shopping is different. And so it can be very unsettling, especially for individuals with autism. So there's several things that I think we can do to help make the routines more predictable and to help make the changes more tolerable. So I think the first one is understanding why we're doing what we're doing. And that means explaining COVID in a way that's appropriate. So if this can be done through social stories, this can be done through videos, depending on the individual's reading level and academic skills. You may find picture-based social stories online. There's a lot of social stories already written online. They may want to research it themselves and look for videos that explain COVID. And so things like the CDC website, CDC has a YouTube channel that explains COVID, and the World Health Organization has some videos. So there's a lot of different resources for understanding COVID, depending on the individual's academic skills and the level of detail that they need. I've found that for a lot of the adolescents and adults that I've worked with, as long as they understand why and we can present the changes and the logical reason for the change, it makes the change easier. It's when they don't understand or when there's not a reason presented for why the change has to occur that it's more unsettling. So explaining why can be very helpful. I think one of the other things that can be helpful is practicing the changes that we're seeing and that we're implementing. So, for example, mask wearing is very new, and it can be very difficult for somebody who has sensory aversions to put a piece of cloth or a piece of material on their face for any length of time. So, looking for materials that are more tolerable. There are some suggestions out there for how to make homemade masks, and so maybe taking some old clothing that the material was more comfortable and turning that into a mask can make it easier, but definitely finding material that's comfortable and then a you know a way to wear it that's comfortable. So over the ears may not be comfortable. They may prefer something behind the head. Um, so looking for those kinds of coping strategies for the sensory aversions, and then practicing. So wearing, even if it's comfortable, even if you're taking a shirt that was previously comfortable and turning it into a mask, wearing something on the body and wearing it on the face may feel very different. And so it may still require baby steps to get to the point where someone can tolerate the mask on their face. And so starting with just touching the mask to the face, being able to wear the mask for 30 seconds, then being able to wear the mask for a minute, until they've worked up to the point where they can wear the mask out in public. Making to-do lists or task lists for washing hands, using the videos and visual cues online that are available to learn the different steps in doing a thorough job washing hands. Using visuals for how to understand what 6 feet is. So if you're not sure what 6 feet is, giving some kind of reference. I know I've seen a number of grocery stores that put together 2 carts face to face in a picture and said that, this is about 6 feet. So something that makes that very concrete can be helpful as well. I think the other thing to keep in mind is that adults who live independently may be struggling right now with things in their regular routine that have changed. So previously being able to go grocery shopping has changed now. And so checking in with adults who live independently to make sure that they are adjusting to those changes in how they go about things in the community. And it may mean creating step by step lists for and problem solving with them these changes and how to go about doing these activities. So, for example, grocery shopping may have gone from going to Walmart to ordering online, going to pick it up, and all of the steps in between. And breaking that down may be overwhelming in this new process. And so, checking in with adults to see if they need any support with that. Probably the biggest thing that we can do, all of us can do, to help us cope and adjust to COVID is maintaining some kind of regular routine. And this is hard when so much of what you usually spend your time doing has changed. So for many of us, work or school are no longer the same, and we don't spend the same amount of time during the day doing those activities. And when we are doing things like work or school, it's online, and so it's completely different. And so finding things to fill that time can be a challenge, but at least keeping some kind of structure to the day, trying to get up at the same time, trying to do meals at roughly the same time, going to bed at roughly the same time. This can be done, again, visual cues are very helpful. So for individuals who may not have the academic skills to read, using pictures to set up the routine for the day. For individuals who are very tech savvy, using phones. A lot of the college students I've worked with really enjoy organizing their to-do list on their phone apps, get very good at using technology, computers and phones, to organize what they need to do and to put some structure in place, using alarms on the phone as reminders for things and when to do things. So those can all be ways to maintain a routine. And then trying to find things to fill that structure and that routine during the day when things like work or school may not be taking up that time anymore. And there's a lot of different ideas out there. I think one of them is to develop their interests. So if somebody has an interest in computer programming, using this time to do online classes for computer programming, building a couple of hours into the day where they practice programming, or they're using some of these online classes and online resources to learn programming. For those who have an interest in animals, taking advantage of the free live webcams that a lot of the zoos out there are offering. So there's a lot of different resources right now that are being offered for free online because of COVID, and these can be opportunities to build up the interests that they may already have. Can also be an opportunity to learn new skills. So, for example, parents who may be home during the day can work with teenagers on things like budgeting. Let them sit down with you, pay bills, show them how to write a check, show them how to go online and pay bills online, show them how you budget your income, show them what things cost. A lot of times there's a misconception for many teenagers about how much it's going to cost to live independently. So showing them how you budget, showing them how you pay bills can help them, give them some real world practical experience that prepares them for independence in the future. Simple things like creating a list of the steps to do laundry and going through that list, posting that list somewhere near the laundry machines so that they're learning to do laundry. Taking this opportunity to learn to cook and to learn the steps in cooking. Again, anything that you can make visual, so writing the list, writing down the steps, and breaking down those steps farther than you would expect to, just if you were trying to do it yourself. And then it can also include learning, engaging in games and things like that with family, using it as some family time as well, but also allowing the individual to have their time alone. They may still want some downtime where they can go be themselves. spend time doing whatever activity it is that they are really interested in. And we want to make sure that they have that time because that can be very calming. So, trying not to take that away from them as well. So, I know, this has been a very challenging time for a lot of people, but hopefully, if we can make it logical, make it more easily understood, and practice the changes that are happening and maintaining as much of a routine as we can, then there are things that are aspects of COVID that can be a very productive time. And hopefully, this information helps. Um, and I hope everyone is able to stay safe during this time.